Now, imaging techniques. There are multiple imaging techniques which are available to not only detect but also to categorize what type of liver lesion that we are dealing with. So, an X-ray abdomen will give us a clue regarding the type of liver lesion where we are looking for the presence of calcification. So, if there is calcification, it points more towards the teratoma of the liver, and similarly henceforth. An ultrasound abdomen again can give us a clue regarding the presence of a lesion involving the liver, whether it is a single lesion, multiple lesions, solid, cystic, septations are present, solid components are present, whether there is an internal vascularity to the lesion, whether it's infiltrating the adjacent structures, whether the rest of the parenchyma appears to be normal or has altered echoes. With the Doppler, yes, of course, the vascularity can be assessed and the blood flow can be assessed. This is particularly useful in the diagnosis of a hemangioma. CT with IV contrast, yes, excellent modality of imaging modality to diagnose liver lesions, particularly benign lesions, particularly hemangiomas of the liver. MRA as a basic imaging modality for liver tumors is not very commonly done, but it can be done to look for vascular anatomy relative to tumors, particularly benign tumors, and also infantile hemangiomas to assess them. Angiography can be done with respect to a liver hemangioma or an AV malformation or arteriovenous malformation involving the liver, particularly if you are planning for an interventional procedure like an embolization. Now, biopsy, so image-guided biopsies in benign liver lesions is not very commonly done. If you know it is a benign lesion, then we know that the treatment of choice is to go ahead with an excision or a resection of the lesion. So, in such cases, biopsy may not be useful. But however, if the diagnosis of the presence of a benign lesion itself is in question, we don't know whether it's benign or malignant, then I agree, yes, a biopsy might be useful. But for a known benign lesion of the liver, or for a suspected with a high degree of suspicion, if you are suspecting a benign lesion involving the liver, a image-guided biopsy may not be very much useful. We can directly go ahead with a resection of that particular segment. So, hepatic hemangiomas. So, hepatic hemangiomas remain the most common benign liver tumors in children. They are more common than all other benign tumors of children put together. Benign liver tumors of children put together. So, it is very commonly detected in a newborn period because it manifests with external manifestations like cutaneous hemangiomas. When you have more than 5 cutaneous hemangiomas, always have the suspicion of the presence of an underlying hepatic hemangioma. So, hepatic hemangiomas are classified into either focal, multifocal or diffuse variants. An earlier terminology of hepatic hemangioma which was used extensively and which is now being given up is what is called as an infantile hepatic hemangioendothelioma. Now, this terminology, infantile hepatic hemangioendothelioma, is no longer used.